So, namaste friends. In the second part of how to increase platelet count, I will share with you what are the common causes of thrombocytopenia or low platelet count. So, first is first is always to get correct manual platelet count. So, many of the low platelet patients may have normal platelet count on manual counting. So, it's very important. When on manual platelet count, platelet is less than 1 lakh per cubic mm, then the common causes which are there, like it could be because of some nutritional deficiency like vitamin B12 deficiency. There are many drugs which can cause low platelet count. Diseases like ITP is one of the common one. Some disease like aplastic anemia, myelodysplastic syndrome, then sometimes liver disease, CLD, portal hypertension, they can lead to low platelet count. Some serious disease like blood cancers, leukemia, lymphomas, they can present with low platelet count. And the chemotherapy drugs, they are notorious for causing thrombocytopenia. So these are the common causes of thrombocytopenia in our practice. And there are some myths involved with low platelet count. So first thing, whenever someone has low platelet count, please don't get scared. It may not be dangerous. It may be mild thrombocytopenia or moderate thrombocytopenia. You need to know what is the cause of low platelet count, but don't get scared unless it is severe, where we have to be very aggressive in managing these patients. Now coming to prevention, many people they ask how we can prevent low platelet count. So there are some precautions we can take, like good proper diet. We can have better lifestyle. We can have, so that we can know what is the platelet status, our platelet status. We can avoid unnecessary drugs, even Ayurvedic homeopathic drugs. They can lead to cytopenia or low platelet count. And all the blood disorders, like serious blood disorders, whenever someone has symptoms, we have to investigate them on time. Early diagnosis is very important, preventive strategy. So if someone has low platelet, then what is the treatment? So as I have said, whenever platelet is less than 1 lakh, we have to evaluate. We have to know what is the cause of thrombocytopenia. And depending upon the cause of thrombocytopenia, if suppose someone has vitamin B12 deficiency leading to low platelet count, we have to correct with B12 supplementation. If suppose patient is on certain drug which is leading to low platelet count, we have to consult our physician or hematologist. We may have to stop after consultation or reduce the dose of drug to minimize low platelet count. When patient is having severe thrombocytopenia, that is when it is less than 30,000, and when a patient is having symptoms, as I have said, skin bleeds or bleeding from any other sides, mainly low platelet count leads to mucocutaneous bleeding. So if it is there, then we may have to again start treatment of the cause of thrombocytopenia. If suppose someone has ITP, then the treatment should be done as per ITP. If suppose someone has some hematological malignancies like blood cancers, aplastic anemia, we may have to transfuse platelets to increase platelet count and stop bleeding. So that is all about the treatment. Treatment depends upon the cause. There are some myths which is very prevalent in our society. I would like to mention that the use of papaya extract, papaya leaves, kiwi fruits, or goat milk is not justified. There is no scientific proof that they works. So please don't get unnecessary use of these things. They don't help in improving the platelet count. These are myths. And whenever someone has low platelet, it's very important that everyone should avoid use of NSAID as painkiller, like Dilona, Brufen, Combiflam, Ibugesic, NICE. These are the drugs which are called NSAID. So whenever you consult any doctor, you have to tell that my platelet count is low, so prescribe drugs which should not affect platelet count is very important. In the last, I would like to say that if someone has a low platelet count, there are many treatments available to increase platelet count. So don't get scared, have hope, consult your hematologist, discuss the treatment options, and whatever treatment is offered, with faith, you continue treatment, you will have improvement. We have seen many patients, they had dangerous thrombocytopenia or very severe thrombocytopenia. They were bleeding from multiple sides, But when we evaluated them, when we knew the cause, we started treating the cause, and most of them they had recovery of their thrombocytopenia or low platelet, and they are now leading their normal life. And in the last, I would have two requests. One request, that we have many patients who require blood transfusion. So all of you who are listening, who are healthy, who are 18 to 65 year of age, this you should come forward to donate blood. Every 3 months a healthy person can donate blood. I have started donating blood. I don't have any problem. I do my work after donating. There is no weakness, nothing. So come forward, donate blood, be a hero. Raktdan is Mahadan. And second thing is, if you have low platelet count, if you are suffering from any disease which has low platelet count, keep your medicines separate at home. So don't keep all medicines of your family members together. What happens whenever you have pain or some problem, you may take some common pills which may be dangerous for patients of low platelet count. So always keep your drugs at separate place. Your painkillers like tramadol, paracetamol, which is recommended for patients with low platelet count, at separate place, so that whenever you need, you can get that, and you will not have any side effects of these medicines. That's all about. And don't get scared. It's not that always platelet transfusion is required. Unless someone has bleeding, unless your hematologist they suggest that your low platelet count needs platelet transfusion, get it. Otherwise, just don't have intention that if I will get platelet transfusion, I will have improvement of platelet count. It's not. There are many causes of low platelet count where platelet transfusion is not required. There are many better drugs which we can use, and we can improve the platelet count to a normal level. Thank you all. If there is any question, you can write in the feedback or in question box. And I would request all of you to subscribe to our channel so that you can listen more blood related issues frequently. Thank you everyone.